Into the Fold is a podcast on mental health issues, produced by the Hogg Foundation for Mental Health. I'm your host, Ike Evans.
First 3 Years work focuses on building long-term sustainable community solution to advance the mental health and development of infants, toddlers, and their families. And we do this by connecting both parents and professionals working with or on behalf of children birth to 3 with access to an understanding of the latest research and best practice for supporting early childhood development, especially social emotional development, i.e. infant mental health. So our main areas of work focus on just really being cross-sector, intentionally keeping top of mind that systems intersect, people intersect, and relationships come first. So we work on supporting that early relational health, strength-based caregiver education with also system building efforts within, again, a cross-sector system, specifically really began this work in child welfare and piloting a really innovative program that is around systems building and best practice. And so that's how, that approach sets us apart in a lot of ways, is that we're not really necessarily, we only push one type of curriculum or one type of program. We don't even have curriculum. So, but at the same time, we revisit, review, and make sure that we're always putting forward the best research and the best practice. And we are the only statewide organization in Texas working to address infant mental health within family serving systems. So we are very broad in our scope, but we're very specific in our mission around infant mental health. It seems obvious that we should be thinking about the relationship in our work, but sometimes we just don't have the tools. And so one provider shared that once she kind of put that front and center and thought about, okay, what could be happening here in this session, this clinical session that I'm maybe missing. And so when she started paying attention to the relationship and gave herself permission to talk to the mom about how things were going and how she was feeling about not just everything in the world, but her feelings with her young child, the mother revealed that she actually was struggling with some postpartum depression. And that impacted the way not only that this clinical provider interacted with mom, but she was able to actually provide some resources on the spot to help that mother. So just one example of how tuning into that relationship, how asking questions about relationships, even when they don't seem like the kind of relationship, you would have with your best friend or potentially a colleague, relationship with an infant or toddler is very, it's a reflection on what is happening in that family's life. And so that opportunity to discuss with the family, hey, I feel like there could be something here. Do you want to talk about it? Is actually a wonderful opportunity to provide that extra support to the family beyond that clinical or potentially educational visit. I'm a new mom. I have a 9-month-old, and I was passionate about this work before becoming a mom, but now that I am a mom, it is so real to me. Not just a living, breathing baby that is going to be a hopefully thriving, happy, healthy adult with lots of healthy relationships and, success in her own way. And so that makes it very real for me. And it makes me even think about how hard it is to parent, to be a caregiver, and not only in this time, but at any time. And that there needs to be even more resources and support for families who have young children. being someone that has resources and support. I'm grateful every day and for what I'm able to provide and the space and time I'm able to dedicate to being a parent. But I know that's not reality for, hundreds of thousands of families in this country.